So, over the last 9 years, I've done a lot of humanitarian aid work. Liberia's been through conflict for 14 years. And through conflict, I saw a lot of humanitarian aid workers come to Liberia to help during the most difficult time of our country's history. I left, and I chose to go to Congo. And everyone thought I was crazy. It was crazy in the sense that how could I have been leaving from a country that's gone through so much conflict to another conflict environment. But as a health worker, there are no boundaries when you have to provide care. So I worked in Congo, I work in North and South Sudan, now in Sudan. And in 2013, I decided to go home to chill out. I ended my humanitarian mission, took on a job with the Ministry of Health. And honestly, I thought it was going to be quiet and nice, and everything was going to work out so easy. It turns out that I started my new role as the health sector pool fund manager at the Ministry of Health in Liberia in September. As part of the first thing I needed to do was to go to the field to be able to see the investment of what we have done relative to service delivery in all of the counties. So I embarked on a monitoring visit in the southeast of Liberia, so quite far away from Montserrat, Monrovia, which is the capital city. And along the way, I traveled with my accountant and the driver. So while we left from one of the counties that is called Grand Gdad and traveling to River G, which is another county in the southeast, I was new to the ministry, and they started to have a conversation with me in the vehicle. We were riding into a double cabin pickup, and they were like, "Boss lady, so we haven't seen anybody." I'm like, "Really? What happens if someone gets pregnant and they have to deliver? Because we haven't seen any facility." And we started to have this conversation. I'm like, "Yes, you haven't seen someone on the road, but there are homes at the back of this bush. So usually, if you were walking along the roadside, you will see these feeder roads, and that's where people will come from onto the main road. But what if they get into labor? What will happen? There's a possibility they will reach at the facility if there's a nearby facility. If there's no facility, whoever is around is going to try and help." Least did I know that this conversation that we were having in the car will be a conversation that will come to reality. What is also interesting about this story is that it's March 2014, a week before Ebola was declared in Liberia. So I'm on the road. Just after the conversation, we passed, and I saw this hand, like somebody trying to call for help. It was very dark. Interestingly, when you travel, having come from a place like Darfur, if you are on the road at 7:30, which you should not be, you will not stop. The driver will say no, even if you said they should stop. But the driver said, "Let's go back." So he reversed, and we came back. On the side of the road, I met this young lady lying down, very helpless. There was a lady next to her and a guy with a motorcycle. They had tried for many hours for the motorcycle to start, but it wasn't starting. So she just laid by the roadside. So I asked, what's the problem? They said to me, "She's in labor." And everyone turned, and the driver and everyone was like looking at me, and I'm like, "We have to help. We are driving a Ministry of Health car. We cannot pass by this lady. It's not going to be so nice." And I think they thought I was a little bit crazy. So I said to them, "Let me take from my bag, let me take the wrap." It was raining, to try and lay it on the roadside while they sort up the car. So interestingly, the car wasn't prepared to have anyone taking a patient. So the driver started to repack the things quickly in the car to try and free up the back space. while I laid the cloth on the side of the road to be able to put her there because she was just like on the roadside. So the lady helped me, and we lifted her up and placed her on the ground. In the car, being a healthcare worker, I only had a first aid kit. I did not have a delivery set. So I started to think very fast. Usually, when someone says they're in labor, the baby doesn't wait for you to have a fabulous facility for it to come. It comes when it's ready to come out. So I was like, guys, you have to hurry. There's no water. I think where we are, I don't even know where I am in the first place. But we had these sacks of water, and I usually travel with plastic containers. I'm like, let's go, cut it fast. So we took the scissors, and we're like fixing the water, and there was some Dettol, and I made water and a solution to try and do something. So he was doing that while I was going to examine the patient. I only had 2 pairs of gloves. 2, just 2, in the first aid kit. So I took the first one and examined her. And when I examined her, the baby was just like almost in my palm. So I'm like, guys, you have to be midwives today. All of you will have to be midwives. Now, traditionally, that's not something a man wants to stand by. So I started to give instruction. This is a team. I've recruited 2 additional midwives. Now, Abby, you are the driver. You're going to catch the baby. Rachel, you my assistant. You're going to flash the light. And the light is the cell phone. So we put the blinkers on in the car because, again, our safety counts. So at least somebody was there. And Rachel would turn like, I need lights. And he would go like this. I can't even see. Rachel is okay. We have to save these 2 lives. So Abby got ready with a towel, put on the heater in the car because it was very cold. I was having on a jumper. And I was in a pool of blood. Nothing could protect me from the blood. Just nothing could protect me from the blood. My sneakers were all soaking in blood. Like it flashed all on me. I couldn't see. I was trying to save a life and I forgot totally about myself, which is what we as healthcare workers do. At that point in time, I was exposing the driver, I was exposing the accountant, be it was an infectious disease, we will all die. At that point, it was about saving 2 lives and forgetting about myself. So the baby came out successfully, which was good. Abby grabbed the baby, became a midwife by force. Now, Richard, you have to show the light. So Richard showed the light until I was able to deliver this lady. So she gave birth on the road. In the midst of nowhere, having a poor healthcare worker that has some skills, but didn't have the right tools to work with. All I did was what I was trained before, use the basic skills I had to save 2 lives in the midst of nowhere. Now, we had to get her to the healthcare facility. I had no idea where the nearest healthcare facility was. So we quickly pulled her together, and the driver drove off. We were able to get to this facility. Fortunately, we had solar light. So we had to go back in, re-examine the lady, retie the cord. And that's how baby Miatta came to life. Baby Miatta was born in the midst of nowhere. Her name is Baby Miatta because, this lovely healthcare worker brought her to life. So baby Miatta and her mom survived. If I look back today, there's some unique things that those who are listening to me today need to hear. Healthcare workers, as in us, gave up ourselves for the life of others. This was barely a week before Ebola was declared. Had it been a week after, and if this mother was positive with Ebola, it would have been a different story. Now, we lost a lot of healthcare workers in Ebola. It was because of the act of caring. When you care, you end up forgetting about yourself. But there are lots of women. If the mom of baby Miatta would have died and baby Miatta in that process, they will never get counted. They will never get counted. The person with the motorcycle and that woman will go back to the village to tell the story that they had died. It will get registered nowhere. So lots of our places, people are dying because they don't have access to health care. They don't have access to healthcare workers with the right skill set that can save many more lives. The training that I got in the most difficult time, using my hands and the little tools I've had, we always don't have any tools when you work in the rural area. I was able to save 2 lives. 2 lives that could have been to my own detriment, or the accountant and the driver that was assisting. So today, baby Miatta and her mom are both alive. Baby Miatta turned 3. Baby Miatta is in school, and her mom is also in school. So she sent me this gift that a healthcare worker saved her life. Make sure you get one of these. Thank you.